Today topic of discussion central nervous system drugs. Here we have three drugs or chapter or unit. First one is sedative or hypnotics. First group of drugs name is called sedative or hypnotics. Second group of drugs anti-Parkinsonian drugs. Third one is anti-epileptic drugs. So in this central nervous system, three type of drugs or three chapter we want to discuss. First one is sedative or hypnotics. Second one is anti-Parkinsonian drugs. Third one is anti-epileptic drugs. We want to discuss one by one. So first one is what is sedative and hypnotic drugs. For what disease we use these drugs? For sleeping. Some people having insomnia. Insomnia. The name of the disease insomnia. They have sleeping trouble. They cannot sleep. They have problem in induction of the sleep, or whenever they sleep, their sleep is interrupted multiple times during the night. They cannot sleep very well. They do not have refreshing sleep. So them we use drugs that name is called as sedatives and hypnotics. Sedative and hypnotics drugs we are use them for insomnia people. So here two main category. Two main category are there. We are having barbiturates. We are having barbiturates and having benzodiazepines. Two main category. Nowadays we are using this mostly using this benzodiazepines. This one only are very this one barbiturate are very dangerous, used for suicidal purpose, and there are very risky. Anyone want to do suicide, they use sleeping pill to do suicide, because they have some mentality like that. If we take one sleeping pill, we sleep. If we take 100 together, we will die. So for suicidal or homicidal purpose, they are commonly used. So they are very dangerous drugs. Barbiturate are very dangerous drug. That's why we don't use them. Nowadays we are using for anesthesia purpose. Use them for anesthesia basically. So this benzodiazepine is the best drugs nowadays. We have newer benzodiazepine. Newer form. That name is called non-benzodiazepines. Newer form also we are using. So we will discuss two main category. One is barbiturate and this one benzodiazepines. Both drugs we want to discuss. So in this sedative and hypnotics, in this one benzodiazepines, this one are better as compared to this barbiturate. This one is the better one and comparing to this barbiturate. So first start with barbiturate. So start with barbiturate. Name of the drugs. We divided them three category: long acting, short acting and ultra short acting. So long acting, only one is there. Okay, only one drugs is there. That name is called as pinobarbitone. Pinobarbitone used for long acting. In short acting, we have butobarbitone and pentobarbitone. Not very important, but okay, this one not that much important. But this ultra short acting, we have thiopentone and methohexidone. So we want to discuss this long acting phenobarbital and ultra short acting thiopentone and methohexidone are important. So these are all barbiturate. For understanding that mechanism of action, we can understand in our brain there are two neurotransmitter. In our brain we have two neurotransmitter. In the brain there are two neurotransmitter, GABA and glutamate. GABA and glutamate. That GABA is inhibitory neurotransmitter. This one is inhibitory one, induced one. This one is excitatory neurotransmitter. Currently, so whenever we sleep, we want haba. Okay, whenever we want to sleep, we want kaba. Kaba is inhibitory neuron. That neuron stop firing and we can sleep quietly. But whenever we are awake, we are using our brain in as the glutamate is activating. It is the neuron, it causes that neuron to fire. We are awake. So sleeping time we need kaba. When awaking time we need, okay, awake condition we want this glutamate. Because that kappa is that inhibitory neurotransmitter, glutamate is excitatory neurotransmitter. For sleeping we required GABA. So we have to understand that GABA receptor. Okay. So see this diagram. In this one, GABA. This one is the GABA. So GABA receptor. GABA receptor is the pentameric structure. Okay, this one is the GABA. This one is the GABA receptor. GABA receptor. Okay, this one is the GABA receptor. GABA receptor is the pentameric structure having 5 unit. 2 alpha, here alpha, 2 beta and 1 gamma. Subunit. So 5 unit, 2 alpha, 2 beta, 1 gamma subunit. It is a pentam having 5 unit. It is the receptor. So here it having receptor. Okay, here it having receptor. Inside that kappa receptor there is chloride channel. So here, see here, this one is the chloride channel is presented. So what is happening normally? Okay, this one is the normal condition. When we go to sleep, so today suppose I want to sleep, okay, at night time, in our brain the GABA will come. Okay, that GABA will come and that GABA receptor, okay, in our here we having that receptor, it is going and binding with this receptor. So it will come here, receptor is presented. So here GABA will come, normal GABA will come, here receptor is presented, both are binding. So go will bind with this GABA receptor. The chloride channel will open. Now only this chloride channel will open. So chloride will go inside. Okay, see that arrow, it will go inside. When chloride will go inside, it will hyperpolarized. Okay, here hyperpolarize the neuron. This is the membrane of that neuron. Okay, so it will come that neuron membrane. uh, so our neuron get polarized, hyperpolarized. Then and there is inhibition of that neuron stop firing. Okay, so can quite sleep. So whenever we are sleeping inside our brain, whenever we are trying to sleep, so inside our brain, GABA will come. GABA will bind with this GABA receptor on the neuron. It will open that chloride channel. That chloride will go inside, will get hypopolarized the membrane of that neuron. So neuron will stop firing. It will be inhibited. So that neuron be inhibited and we can quietly sleep. Okay, when all the neurons stop firing, we can sleep quietly. So this is how we people sleeping. So what is the mechanism? GABA will come and bind with this GABA receptor. That time chloride channel will open. Okay, so, okay, after that what will happen? So this chloride channel will open, then hyperpolarize that neuron. Okay, so that means inhibition of that neuron, stop firing, inhibition of neuron. Then after that we have sleep. So GABA receptor pentameric structure having 2 alpha, 2 beta, 1 gamma inside chloride channel. Okay, that GABA will bind with a receptor, then chloride channel will open, hyperpolarization, then inhibition of neuron, stop firing, then we have sleep. Next we want to discuss the drugs. Barbiturate. What is the mechanism of barbiturate? There are three mechanism of action of barbiturate. One is kappa facilitatory action, then mimetic action, then inhibit glutamate, induced depolarization. Here either it inhibit the glutamate or increase that kappa. Kappa is inhibitory. So we have two neurotransmitter. We know kappa and glutamate. So both are okay. This one inhibit that kappa. This one decreasing that glutamate. So this one GABA inhibitory reaction. This one is the glutamate excitatory reaction. GABA, this both mechanism of action will inhibit that GABA. This one uh, excitatory that glutamate, decrease that action of glutamate. So that insomnia patient, okay, who having that sleeping disturbance, insomnia patient, they will take that barbiturate drugs, that one increasing that kappa, that means they have sleeping, so it will decreasing that glutamate. So first one is kappa facilitatory action. uh, this person, okay, say for example the person who having insomnia, okay, this patient having sleeping disorder, insomnia patient cannot sleep, so doctor want to give a drugs to a person in which it can induce the sleeping, so doctor have to give a drug. So the drug which can increases that kappa or decreases the glutamate, so the person can sleep. So doctor giving barbiturate. So this barbiturate increase GABA by two method. It is inhibit glutamate. So this is a triple action of barbiturate. So by using these two method it will increases that kappa. Then next method it will decreasing that glutamate. So first method it will opening that chloride channel, timing will increases. This time only binding process will occur. We want to discuss that one. So what is kappa facilitatory and kappa mimetic? uh, can you see this is the barbiturate? Okay, suppose we are taking a tablet. Okay, this person taking a tablet barbiturate. The tablet is going inside, it is observed and it is going in our blood. Via blood it reaching to our brain. Inside our brain on that neuron the same receptor of calm. So now that patient taking that barbiturate tablet. Okay, so same here also that GABA receptor is present and no that same receptor only. So whenever patient taking tablet it is going via blood, it reach to brain. Inside brain the neuron same receptor for GABA receptor here present and no the same receptor bind. So it bind with the same receptor on which natural GABA bind. Okay, so how that GABA will bind at that same place only, that barbiturate will binding here. After binding what it will doing, it will increasing that affinity. Okay, it will increasing that affinity of the channel for that GABA. So initially the GABA is binding, so chloride channel is opening. One normally 1 millisecond opening means now because of that barbiturate, that is same chloride channel. Okay, here also it will opening for 10 millisecond. GABA will open. Okay, GABA will bind that receptor means that chloride channel only 1 millisecond will open. This one when we are taking giving that barbiturate to patient 10 millisecond open. So it is increasing the time of chloride channel opening. So more chloride will go inside and the neuron will become hyperpolarized and that person. So normal 1 millisecond, after barbiturate 10 millisecond. So that patient more chloride enter inside and the neuron will become hyperpolarized and that person can sleep. So basically it is a kappa facilitatory action. Okay, so here increasing the time, that is name is called as facilitatory action. What do you mean by facilitatory action? Here the barbiturate increasing that action of natural GABA. It is not showing its own action. Okay, here not any action, it will increasing the time only. What that barbiturate doing? Barbiturate is not opening that okay, here not opening that chloride channel. This increasing that duration of the time, increasing duration of the time. So here what it will do, it is not opening the chloride channel, it is increasing the duration of opening that chloride channel. Okay, here it is increasing the duration of opening chloride channel which is opened by kappa. So basically it is a augmenting function of inherited hava. So augmenting functions of inherited hava. So barbiturate concerning kappa that just increase it for more time. It is not itself, it increasing that kappa facilitate action. So next one is kappa mimetic action. Barbiturate is binding with the receptor and itself it is opening that chloride channel also itself. it is opening that chloride channel also. So basically it is increasing that chloride channel duration via kaba also, and it is to be opening. So it is having double action. What are the two things? Facilitatory action, it will increasing the timing. So second one is kaba mimetic action, it will open that chloride channel. So it will do double role here, double action. So third action, it inhibit glutamate. So this is the triple action of barbiturate. First one is facilitatory action, second one is mimetic action. Both are increasing kappa, so it induces the sleep. Third one is decrease that glutamate. Next one is uses.